For this session, I'm going to talk about public administration. I do not claim to be comprehensive. I just want you to have a working knowledge on public administration. I'm going to reshare my old slides, but I made some edits, especially on the organizational chart of the new Department of Health.
These are my objectives. At the end of the session, the student should be able to know the history of public administration, differentiate the different elements and concerns of administration, enumerate the different managerial functions and roles, discuss general principles of management, enumerate characteristics of an efficient health system, differentiate the different organizational charts, and differentiate the different types of health systems. The Study of Administration is an 1887 article by Woodrow Wilson in Political Science Quarterly. It is widely considered a foundational article in the field of public administration, making Wilson one of the field's founding fathers, along with Max Weber and Frederick Winslow Taylor. Although colleges were already teaching administration in the 1880s, it was considered a subfield of political science. Wilson argued that it should be treated as its own field of study, with public administrators being directly responsible to political leaders. He believed that politicians should be accountable to the people and that political administration should be treated as a science and its practitioners given authority to address issues in their respective fields. For Wilson, the object of administrative study was to discover first what government can properly and successfully do, and secondly, how it can do these proper things with the utmost possible efficiency and the least possible cost, either of money or of energy. In so doing, Wilson laid out key observations regarding public administration that still form the backbone of the discipline. What are the concerns of an administration? First, technical, it should fulfill its mandate. 2 is commercial. This is the organization's ability to address a problem with the services and resources that the organization has. 3. Financial. It has money to sustain its operations. 4. Security. It can safeguard the organization by protecting its honor or by securing its data privacy. 5th, accounting. There is a unit which evaluates the financial operation. And managerial, there are managers who direct the function of the organization. We define management as the art of getting things done through people by proper allocation and choice of human resources, man, money, materials, and methods. These are the 3 categories of budget. Personal services are the salaries of personnel and can comprise 55% of the budget of an agency. MOOE is the maintenance and other operating expenses, which refer to expenditures to support the operations of agencies, such as expenses for supplies and materials, transportation and travel, and utilities. And third, capital outlays refer to goods and services, the benefits of which extend beyond the fiscal year and which add to the assets of the agency. These are functions of management. Different books will include different sets of functions. We will discuss these functions in the next slide. These are the functions of management. Planning is the formulation of the policies, strategies, programs, procedures, and rules needed for the accomplishment of the goals and objectives of the organization. Organizing, it is the division of labor and corresponding assignment of duties and the establishment of the lines of authority and of communication. Directing, it is the initiation and maintenance of actions towards the objectives of the agency. Effective directing requires delegation, communication, training, and motivation. Coordinating is the concern of the administrator to see to it that every activity within the organization fits effectively and efficiently into the whole scheme of the operation. It is the synchronization of activities towards well-established goals. Monitoring and control is keeping track of the work of an agency to find out if it is being carried out the way it should be in accordance with the standards of quality and quantity agreed upon at the proper time and at the cost previously determined. It is based on a plan of work with indicators and milestones. While evaluation is a systematic way of learning from experience and using the lessons learned to improve current activity and promote better planning by careful selection of alternatives to future action. As to the managerial levels, the first level may be the department heads. The middle level is the immediate boss of the first level, can be section head or division head, and the top level is the president or chairman. The top level management is in charge of the policies, the middle level is in charge of programs, and the first level implements projects. You were taught the difference between programs and projects in a previous lecture. As a manager, one fulfills many different roles every day. Put simply, a manager constantly switches roles as tasks, situations, and expectations change. For the interpersonal category, the manager is a figurehead. He has social, ceremonial, and legal responsibilities. He is expected to be a source of inspiration. People look up to him as a person with authority and as a figurehead. The manager is also a leader. This is where he provides leadership for his team, his department, or perhaps his entire organization. He is also a liaison. Managers must communicate with internal and external contacts. He needs to be able to network effectively on behalf of his organization. For the informational category, the managerial roles in this category involve processing of information. The manager is a monitor. In this role, he regularly seeks out information related to his organization and industry, looking for relevant changes in the environment. He also monitors the team in terms of both the productivity and their well-being. He is also a disseminator. This is where he communicates potentially useful information to his colleagues and his team. He is a spokesperson. Managers represent and speak for their organization. In this role, he is responsible for transmitting information about his organization and its goals to the people outside it. For the decisional category, the managerial roles in this category involve using information. The manager is an entrepreneur. As a manager, he solves problems, generates new ideas, and implements them. He is a disturbance handler. He mediates disputes within the team. He is a resource allocator. He'll also need to determine where organizational resources are best applied. This involves allocating funding as well as assigning staff and other organizational resources. And finally, he is a negotiator. He may be needed to take part in and direct important negotiations within his team, department, or organization. These are the general principles of management. Authority and responsibility. There should be a balance between authority or power and responsibility or duties. The right to give orders should not be considered without reference to responsibility. If the authority is more than the responsibility, then chances are that a manager may misuse it. If responsibility is more than authority, then he may feel frustrated. Division of work. Dividing the full work of the organization among individuals and creating departments is called division of work. Division of work leads to specialization, and specialization helps to increase efficiency, and efficiency which results in improvements in the productivity and profitability of the organization. Unity of command. According to this principle, a subordinate must have and receive orders from only one superior. To put it in another way, a subordinate must report to only one superior. It helps in preventing dual subordination. This decreases the possibilities of dual subordination, which creates a problem, is a function of managers. Unity of direction. One head and one plan for a group of activities with the same objectives. All activities which have the same objective must be directed by one manager, and he must use one plan. This is called the unity of direction. Span of control. Span of control refers to the number of subordinates under a manager's direct control. As an example, a manager with 5 direct reports has a span of control of 5. Span of control is a good metric to assess the efficiency of an organization as long as it looked at in the context of the company's organizational structure. These are examples of organizational charts: position chart, functional chart, and divisional chart. This is an organizational chart based on positions like managers, directors, engineers, supervisors, etc. This is a divisional structural chart. The divisional structural chart is based on products. In a divisional structure, your company groups workers into teams based on the products or projects that meet the needs of a certain type of customer. The functional org chart is a very common organizational structure that many companies follow, which is supposed to divide people into several departments according to people's specialties and function they perform in the company. This is the revised organizational chart of the Department of Health. The current Department of Health Secretary, Dr. Duque, calls it the DOH Functional Management Teams. There are 7 functional teams which are headed by an undersecretary and assisted by an assistant secretary. I will go back to this slide later in my presentation. Some positions are primary to the company's mission, or what we call line function, meaning they have functions which produce the products that the company is for, whereas others are secondary in the form of support and indirect contribution, or what we call a support function. Although positions within a line and staff organization can be differentiated in several ways, the simplest approach classifies them as being either line or staff. In the Department of Health, the main functions of that government agency is to provide promotive, preventive, and curative care. So those who deliver these functions have line functions. For example, I learned as a master's student that UERM Medical Center's 3 vice presidents, the VP for Hospital, VP for Academic Affairs, and VP for Research, perform line functions. It is UERM's mission to take care of patients, so the products there are services that the hospital offers to patients. Secondly, to produce medical, nursing, PT, orthotics, and masteral graduates. And thirdly, to produce researches. These VPs that I mentioned have line functions. The other VPs like Finance, Treasury, Administration have staff function. They assist these VPs in order to accomplish the mission of the medical center. There are different forms of communication that are normally disseminated to the personnel in a government agency. I underlined the words that will differentiate one from the other. I also gave an example for each. So these are administrative order, which provides policies, standards, rules, or general instructions for the proper and efficient administration. So example of an administrative order is Administrative Order Number 01, Series 2012. Subject is Implementing Rules and Regulation of Reproductive Health Bill. A department circular, on the other hand, is a general communication with reference to the internal administration of the office. It may consist of instructions on how a policy or procedure shall be implemented. An example of a department circular is a department circular on rules on monetization of vacation leave. Memorandum order. This is a general communication as a reminder of matters dealt with in orders, circulars, or instructions which are not fully implemented. Example is the submission of monthly reports. Department order. It's confined to a particular purpose or a specific object, person, or class, usually involving movement of personnel. An example of which is the temporary reassignment to Parañaque Hospital of a specific person. Let's now go to health systems. There are 2 types, the centralized and the decentralized. Centralization and decentralization are 2 modes of working in any organization. In centralization, there is a hierarchy of formal authority for making all the important decisions for the organization. And in decentralization, decision-making is left for the lower level of organization. These are the forms of decentralization. deconcentration assigns specific functions and tasks performed by the staff of the headquarters of central administrations to staff posted in peripheral locations within the national territory. Staff, equipment, vehicles, and budgetary resources are transferred to units such as regional and district offices. The managers of these units are given authority for autonomous decision-making regarding the operations which were previously taken at headquarters or needed clearance from headquarters. Number 2, by delegation, a well-defined set of tasks, functions, and authority are transferred to organizations outside the central government. So it's given to autonomous local health authorities. Devolution. The primary objective of devolution requires that beneficiaries participate normally through representatives elected to the local government in planning the delivery of services and in the evaluation of the services provided. Local governments are assigned the responsibility of deciding which services should be provided on a priority basis and to whom. Decentralization can take the form of privatization. Typically, with privatization, the consumer pays for the service being delivered, but government may still subsidize or tax certain services to achieve its objectives. Government also can outright sell or partially sell assets of the state. This is the revised organizational chart of the DOH. The current DOH Secretary, Dr. Duque, called it the DOH Functional Management Teams. There are 7 functional teams which are headed by an undersecretary and assisted by an assistant secretary. Under the functional teams are bureaus. The bureaus are under a director. I will only be discussing some of the bureaus we sometimes hear over the news. The first team is the Administration and Financial Management Team, which is in charge of money matters and personal matters. The second team is the Health Policy and System Development Team, which is in charge of the health sectoral policies. Under this bureau is the Health Policy Development and Planning Bureau. This is the DOH team who attends budget hearing. The Bureau of International Health Cooperation is the link of the DOH to the international partners like WHO, UNICEF, and USAID. For the Public Health Services team, under it are the Disease Prevention and Control Bureau. This is where the different disease prevention programs are lodged. The Epidemiology Bureau is in charge of surveillance of diseases and in charge of COVID Kaya, which releases statistics on COVID. The fourth team is the Health Facilities and Infrastructure Development Team. This is in charge of prescribing standards for hospitals, clinics, laboratories, whether private or public. The Knowledge Management and Information Technology System is in charge of the databases of DOH, records, reports, field health registration, including vaccination of patients for COVID. The fifth team is the Health Regulation Team, which is comprised of the regulatory bodies like FDA, Health Facilities and Regulatory Bureau. The latter is in charge of licensing hospitals. The Bureau of Quarantine is in charge of monitoring entry of diseases of concern like COVID into our country. The sixth functional team is the Procurement and Supply Chain Management. This team is in charge of all the supplies, medicines, and lately COVID vaccines. The last is the Field Implementation and Coordination Team. There are 3 clusters: Luzon, NCR, and Visayas, Mindanao, and there are regional offices we call Centers for Health Development. They are the ones who coordinate with the LGU in implementing the programs of the Department of Health. The LGUs, on the other hand, are the service providers. The central office has to go through the regional centers for health development before they can ask the LGU to implement the government programs at the LGU level. This is the present setup of our health system. The DOH is responsible for some of the retained hospitals in Metro Manila, specialty hospitals, and some regional hospitals, while the rest of the hospitals are under the local governments. In the devolved setup, DOH Central Office cannot directly go to the local government but will have to pass through the Central Health Development Regional Director if there are programs the Central Office wants to implement. These are the levels of the healthcare system. The primary level is the first contact provided by health centers. Secondary level is provided by district hospital or referral center. And tertiary level is provided by specialty hospitals. Lastly, here are the 4 E's of a well-performing health system. Effective is doing the right things right. Efficient is doing things right. Equitable is being fair in financing and utilization, providing to those who need it most. And empowering is the active ownership, participation, and transparent decision making. In health systems, equity is being practiced than equality. Equality means each individual or group of people is given the same resources or opportunities, while equity recognizes that each person has different circumstances and allocates the exact resources and opportunities needed to reach an equal outcome.
On this slide is the new Department of Health organizational chart. It still remains a functional chart, but this time there are more teams compared to the old one, um, where there are 7 teams. Here in this new Department of Health organizational chart, there are 10 teams. More or less, they are serving the same functions as the old one. It's just that probably some of the teams were broken down into smaller teams in order to uh, do its function in the department.
In summary, we discuss history of public administration, the different elements and concerns of administration, the different managerial functions and roles, the general principles of management, the characteristics of an efficient health system, the different organizational charts, and the different types of health systems. And these are my references. Thank you.